So, welcome to this class on gluteal region. The gluteal region, which we call as buttock, okay, which is on the posterior aspect below the trunk. And when we look at it from behind, from the posterior aspect, this is the natal cleft. These are the iliac crest. Iliac crest anteriorly end at anterior superior iliac spine, and posteriorly they end at posterior superior iliac spines. Okay. Then the gluteal folds are there like this, the skin folds, the gluteal skin folds, and above here is the ischial tuberosity on which we sit. Ischial tuberosity. On the lateral aspect over here are the greater trochanters of the femur. Greater trochanter of the femur. And this in between is the natal cleft. This is the natal cleft. So these are the surface landmarks in this area. When we look from the lateral aspect after removal of the skin, when we see on the lateral aspect, this is how we see it. When we see from the lateral aspect, there is this thin deep fascia below the skin and superficial fascia which is covering the gluteus maximus. This huge muscle. So this is anterior side, this is posterior side. This huge muscle is gluteus maximus. And above here we see below the gluteus maximus and slightly protruding out is the gluteus medius muscle. Okay. And then there is this thick fascia on the back side. Okay. Of the thigh. So basically this huge muscle in this region is the gluteus maximus muscle. Another view for this, if we want to see, this is the deep fascia and this is the huge gluteus maximus muscle. Okay, and below the maximus is the gluteus medius, and below the medius is minimus. Okay, so that's how medius is slightly seen above. When we are looking from this aspect, we see medius slightly above the gluteus maximus, and this is gluteus minimus over here. Okay. Now let me enlist the muscles which we are going to study in the gluteal region. Firstly, the three gluteal muscles. Gluteus maximus, which is the most superficial, maximus. Below that is gluteus medius. So once we remove the maximus, we'll see the medius. And below the medius is minimus. Okay, gluteus minimus. Then actually in this region, we see the piriformis. After removal of gluteus maximus, we see the piriformis. Below the piriformis, we see the tricipital tendon. What is this tricipital tendon? Superior gemellus, obturator internus, and inferior gemellus. And below that is quadratus femoris. Quadratus femoris. So this is the medial side. They are taking origin from the hip bone, and they are getting inserted on the greater trochanter. So this is the greater trochanter. So gluteus medius will be here somewhere, and below the medius will be the minimus, and covering all of them is gluteus maximus. So once we remove the maximus, we see the gluteus medius here, piriformis. Then we see the superior gemellus, inferior gemellus, and in between we see obturator internus, and then we see quadratus femoris. Okay, also obturator externus is included in this compartment also. Sometimes it is included in the medial compartment of the thigh. So total 1, 2, 3 gluteus maximus, medius minimus, 4 is piriformis, 5 is superior gemellus, 6 is in obturator internus, 7 is inferior gemellus, and 8 is quadratus femoris. Obturator externus sometimes is also included in this region. Now let us try to understand the origin of gluteus maximus muscle. Before I start talk anything about gluteus maximus, it is the chief extensor of the hip joint. Chief extensor of the hip joint. Okay, chief extensor of hip, and it is the muscle which is used in which is used in climbing stairs. Okay, climbing stairs. So when we are climbing stairs, gluteus maximus is used the most. Okay, so the sites of the origin, for that we have to go back to the hip bone, and when we go to the hip bone anatomy, this diagram of the hip bone we need to understand for the origin of gluteus maximus and minimus. We see this gluteal surface of the hip bone, and on that gluteal surface we see three lines, 1, 2, and 3. So this is the posterior gluteal line, this is the anterior gluteal line, and then we see the inferior gluteal line. Okay, so behind the posterior gluteal line is the origin of gluteus maximus. Between the anterior and posterior gluteal line is the origin of gluteus medius, and between the anterior and inferior is the origin of gluteus minimus. Okay, these are the origins of the gluteal muscle from the gluteal surface. Now, gluteus maximus has multiple sites of origin. This was just one site of the origin. Even when we see the iliac crest, when we see the iliac crest, the gluteus maximus is from the posterior part of the dorsal slope of the iliac crest. Okay, we see that here is the external oblique, then internal oblique, and transversus abdominis. Okay, quadratus lumborum is here, latissimus dorsi takes origin from here. So the origin of the gluteus maximus, here we have just seen two sites already. One is the posterior gluteal line, and another is gluteal surface behind the posterior gluteal line. So this is one gluteal line, is one posterior gluteal surface behind the posterior gluteal line is another. Dorsal slope, outer slope of the dorsal segment of the iliac crest is 3. So 3 sites I have shown here. Posterior gluteal line is 1, gluteal surface behind the posterior gluteal line is 2, the outer slope of the dorsal segment of the iliac crest is 3, 4 is aponeurosis of erector spine. Okay, 5 is the dorsal surface of the lower part of the sacrum. Okay, so dorsal surface of the lower part of the sacrum. Okay, aponeurosis of erector spine. 6, the side of coccyx. That means it is taking origin from hip bone, it is taking origin from the sacrum, from the dorsal surface of the lower part of the sacrum, from the side of the coccyx, from the sacrotuberous ligament. Sacrotuberous ligament. And 8 is the fascia covering gluteus maximus. So sacrotuberous ligament and fascia covering gluteus maximus. So 8 sites of origin of the gluteus maximus. Posterior gluteal line, gluteal surface behind the posterior gluteal line, outer slope of the dorsal segment of the iliac crest, aponeurosis of erector spinae, dorsal surface, lower part of the sacrum, side of coccyx, dorsal and lower part of the sacrum, side of coccyx, sacrotuberous ligament fascia covering the gluteus maximus, and its insertion. Its insertion is on the 1/4 of the fibers. They get inserted on the gluteal tuberosity of the femur, and the fourth of its fibers. The fourth of its fibers get inserted on the iliotibial tract. On the iliotibial tract. The nerve supply is from inferior gluteal nerve. Root value is L5, S1, S2. Okay. What are the actions of the gluteus maximus muscle? The gluteus maximus muscle is the, as I said, chief extensor of the hip joint. Chief extensor of the hip joint. Basically, getting up from the sitting position. Also, by its that is called as a paradoxical action. Paradoxical action. It also, by its relaxation, help us to sit. The main is getting up from sitting position. Okay, from standing, from sitting to standing is its main action. But even sitting also, its controlled relaxation happens. Okay, it is also the lateral rotator of the hip joint. Lateral rotator. It also causes abduction of the hip joint. Okay, and because it gets inserted on the iliotibial tract, on which tensor fascia lata also gets inserted, so it stabilizes the knee joint. It stabilizes the knee joint in extended position. So has an action on the knee joint also in extended position. Okay, I'll repeat again. It is a chief extensor of the hip, as in climbing stairs, and mainly getting up from sitting position. Also during walking, also it is involved. Okay, and paradoxical action is it helps by its control relaxation. It helps us in sitting from standing. So main action is by its contraction. It helps us to stand from sitting position, and by its relaxation, it helps us to sit from standing position. Okay. Lateral rotation, abduction, and stabilizes knee joint in the extended position. The next muscle which we are going to study is gluteus medius and minimus. We are going to study them together. Their origins now are already in front of us. Gluteus medius takes its origin between the anterior and posterior gluteal line. Gluteus minimus is between anterior and inferior gluteal. Now let's talk about the gluteus medius and minimus. So origins we have already seen their insertion. Gluteus medius gets inserted on the lateral surface of greater trochanter. Okay, lateral surface there is an oblique ridge, and on that greater trochanter of femur it is inserted. Okay, minimus gets inserted on the lateral surface. Okay, or I would say lateral part of anterior surface of greater trochanter of lateral part of anterior surface of greater trochanter of femur. So gluteus maximus is on posterior surface, medius is on lateral surface of the greater trochanter, and minimus is on the anterior surface but lateral part. So this is on anterior surface, this is on lateral surface. Okay. Nerve supply of both of them is superior gluteal nerve. Superior gluteal nerve, and the root value of which is L4, L5, and S. The action of these two muscles. Why I am dealing with these two muscles together? is because the actions of these two muscles is also to be dealt together. Now suppose this is the pelvis and this is the femur and this is suppose the greater trochanter. So the gluteus medius and minimus together, they go like this and get inserted on the lateral part and lateral surface of the anterior part. So this is gluteus medius and minimus together. So their one action is that if this leg is stable, they will cause abduction of the hip. Okay, so they are powerful abductors, and because they are also inserted on the anterior surface, okay, they will also cause medial rotation. So together they cause abduction and medial rotation of the hip joint. Abduction and medial rotation of hip joint. Now, when opposite foot is on the ground, it causes abduction. But when opposite foot is off the ground and this foot is on the ground, so when opposite foot goes off the ground, there is a tendency for the pelvis to sag down because this foot is now up, so this pelvis may sag down. So that time this end it pulls, this end it pulls, and this by pulling it, it prevents the sagging down of opposite pelvis. So prevents the sagging down of opposite pelvis. Okay, prevent the sagging down of opposite pelvis when opposite foot is off the ground. Okay, so when opposite foot is off the ground, this pelvis may sag down, so it pulls it from here because this end is now stable. When opposite foot is on the ground, this end is stable, so it causes abduction and medial rotation. Okay, the next muscle in this is piriformis. For origin of piriformis, we all study the sacrum, right? And we all know that from the anterior surface of the sacrum, there is the E-shaped origin of piriformis. E-shaped origin of piriformis. And after taking origin, the muscle passes through the greater sciatic notch. On both the sides, it passes through the greater sciatic notch. And gets inserted on the tip of the greater trochanter. It gets inserted, the muscle gets inserted on the tip of the greater trochanter. So this is greater trochanter. The muscle passing through the greater sciatic notch on both the sides will get inserted on the tip of the greater trochanter. So the nerve supply of the piriformis is nothing specific. We are talking about piriformis muscle taking origin from the anterior surface of the sacrum in an E-shaped way, goes through the greater sciatic notch and gets inserted through the. It is a key muscle of the gluteal region. The reason is most of the structures, nerves, vessels, they come out below it, and it is supplied by the ventral rami of S1 and S2. Okay, as regards the action of the piriformis muscle is concerned, the piriformis obturator internus. Now, whatever muscles we are going to discuss now, piriformis, the obturator externus, obturator internus, quadratus femoris, they are all called as the lateral rotator. They are the lateral rotators of the hip. So this is the lateral rotator of the hip. Okay, that means abductor and medial rotator is gluteus medius and minimus. Gluteus maximus is the extensor, and now remaining all muscles are short lateral rotator, and we have already seen the piriformis among them. After this, we will be studying the gluteus maximus and the gemellus superior and the gemellus inferior. So when we talk about the two gemelli, okay, and we see their origin. If you want to see their origin, we need to know the anatomy of the ischial spine. If we study the anatomy of the ischial spine properly, the ischial spine, there is the greater sciatic notch, and then there is the ischial spine, and then there is the lesser sciatic notch. So on the upper part of the lesser sciatic notch is gemellus superior, and on the lower part of The greater sciatic notch is gemellus inferior. So it's gemellus superior and here is gemellus inferior. And in between them, the obturator internus muscle, which is on the inner side, of the obturator foramen. So that obturator internus comes to the lesser sciatic notch. That means piriformis comes to the greater sciatic notch, and through the lesser sciatic notch, comes obturator internus muscle. And above the lesser sciatic notch is the origin of gemellus superior, and below is the origin of gemellus inferior. And together they go like this, and they get inserted on the medial surface of the greater trochanter. So gemellus superior, obturator internus, gemellus inferior on the medial surface of the greater trochanter. So piriformis was coming like this and getting inserted on the tip of the greater trochanter, and on the medial side of the greater trochanter is gemellus superior, obturator internus, and gemellus inferior. Okay, and below that here is the origin of quadratus femoris. The quadratus femoris, the origin is again from the outer border of the ischial tuberosity. So if I have to show the origin of the quadratus femoris muscle, the quadratus femoris muscle, it will take its origin from the bony from the upper part and outer border of the ischial tuberosity. So the quadratus femoris will be here, and it will also get inserted into trochanteric fossa on the medial side of the greater trochanter. The quadratus femoris is here, and trochanteric fossa, which is there on the medial surface of the greater trochanter, is here. So these muscles, piriformis on the tip of the greater trochanter, superior gemellus, obturator internus, gemellus inferior on the medial surface of the greater trochanter, and trochanteric fossa, a quadratus femoris. So these muscles, piriformis, all these four, these 1, 2, 3, 4, 5, these 5 muscles are the lateral rotators. Lateral rotators of the thigh. Lateral rotators. All of them come under the category of lateral rotators. Okay. Gemellus superior from upper part of the lesser sciatic notch near the ischial spine. Gemellus inferior from the lesser sciatic notch, lower part, and obturator internus tendon comes from the lesser sciatic notch. Quadratus femoris is from the outer border of the ischial tuberosity and gets inserted. Obturator externus gets inserted on the trochanteric fossa, while the quadratus femoris, sorry, I said on the trochanteric fossa, the quadratus femoris gets inserted on the quadrate tubercle. There is a quadrate tubercle. Okay, it gets inserted on the quadrate tubercle, and obturator externus gets inserted on the trochanteric fossa. I'm so sorry for this. Now let's check their nerve supply. So we have this gemellus superior, then we have the obturator internus, then we have gemellus inferior, then we have quadratus femoris. So there is nerve to quadratus femoris, and there is nerve to obturator internus. The nerve to obturator internus supplies gemellus superior, nerve to quadratus femoris supplies gemellus inferior. This is how we remember. Gemellus superior or inferior don't have their own nerves. They are supplied by the nerves supplying the muscle below it. So obturator internus is below gemellus superior, so it supplies nerve to is supplied by nerve to obturator internus. Quadratus femoris is below the gemellus inferior, supplied by. Okay. Apart from this, there are these muscles like obturator externus in this area. Like obturator internus is from the inner part of the inner margins of the obturator foramen. This is from the outer margin, and obturator externus gets inserted on the trochanteric fossa. Okay, on the medial side of the greater trochanter. There is one more muscle called as tensor fascia latae. Tensor fascia latae. This tensor fascia latae muscle, it takes its origin from the outer lip of the iliac crest, anterior 5 centimeter, outer lip of the iliac crest. So we have seen the iliac crest over here. The outer lip of the iliac crest, tensor fascia lata, will be taking will be taking its origin. Okay, and its insertion is on the iliotibial tract. That means on the iliotibial tract, on the iliotibial tract. If this is the iliotibial tract, if this is the iliotibial tract, coming from posteriorly on its insertion is gluteus maximus, and coming from anteriorly is the tensor fascia lata. Okay, and this iliotibial tract goes and gets inserted on the tibia, and that's how the gluteus maximus and tensor fascia lata through this iliotibial tract, they stabilize the knee joint in the extended position. Now let's talk about the clinical anatomy. Let's talk about the clinical anatomy of these joints. The intramuscular injections, IM injections are given in gluteus maximus in the anterior-superior quadrant. In the anterior-superior quadrant, if this is the gluteus maximus, this is the medial, this is the lateral, and okay, and this is the superior, this is the. So here in this quadrant is the place where the intramuscular injections are given. Okay, in case of the paralysis of gluteus maximus muscle, the patient climbs over himself. The patient climbs over himself. Okay, that's what we say, because he has to get up very slowly, because gluteus maximus is the one which helps in standing from the sitting position. Okay, now what happens if gluteus medius and minimus are paralyzed? Even both of them are paralyzed, the patient on both sides, if it get paralyzed, a patient shows what is called as waddling gait. A person gets what is called as waddling gait, because whenever he steps, the outside, the pelvis of the other side sags down, and therefore the patient to lift that sagging pelvis, he moves slightly laterally. So that kind of gait is called as waddling gait. Okay, so in this region, we all of us, we have already listed the nerves which we see. The ligaments which we see are the sacrotuberous ligament and the sacrospinous ligament. Why I am listing these ligaments? Because there is a question called as structures under cover of gluteus maximus. That means you have to write the name of all these muscles. You have to write the name of all the nerves supplying these muscles, like the superior gluteal nerve, inferior gluteal nerve. The sciatic nerve is also mainly seen in this region, because when this is the piriformis, okay, and then there is the the superior gemellus, inferior gemellus, and the coming out from the greater sciatic nerve and going over the quadratus femoris is the going over the quadratus femoris is the sciatic nerve. Okay, so therefore we need to understand that the that sciatic nerve, the sciatic nerve is also a very important component of this gluteal region, and it runs over, it comes below the piriformis and passes over all this superior gemellus, obturator internus, inferior gemellus, and quadratus femur, and that's how it goes on. Apart from that, there is now two obturator internus, the two quadratus femoris, all these nerves are there. Okay, there are arteries like superior gluteal artery in this region. Okay. So there is superior gluteal artery, inferior gluteal artery. These are the very important arteries in this region. And there are two anastomosis called as trochanteric anastomosis and cruciate anastomosis. I will make a separate video of this thing. As regards your vivas are concerned, there are some questions asked on this, and that is the structures passing through the greater sciatic foramen and lesser sciatic foramen. Greater sciatic foramen, all of us know that piriformis passes, and above the piriformis goes the superior gluteal nerve, superior gluteal vessels. Below the piriformis is inferior gluteal nerve and vessels and sciatic nerve. Okay, and all other nerve, all remaining nerves like nerve to quadratus femoris nerve, the internal pudendal vessels, nerve to obturator internus. The structures coming out of the lesser sciatic foramen is the tendon of obturator internus, pudendal nerve, internal pudendal vessels, and the nerve to obturator internus. Okay, so, and of course in the exam comes the famous question, what are the structures which come out of the greater sciatic notch and which enter the lesser sciatic notch? Okay,